Hi, everyone, and welcome to Clinical Solutions What's on Our Minds. My name is Amy Perello, and I'm an implementation manager for EBSCO Health on the Clinical Solutions team. Normally, you might find me training on one of our clinical resources like Dynamed or Dynamic Health. Sometimes you may find me helping a hospital integrate these systems into their everyday workflow so that they can get to them quickly and easily. Today, you'll find me here talking to you about some of these resources and what they can offer with regards to our topic of the day. As always, what we discuss in these videos is not intended to be taken as medical advice. Every patient is unique, and our clinical decision tools help support clinicians by presenting the most recent clinical evidence to improve their decision-making, care, and practice. What we want to provide you here is what the latest evidence is saying about some timely topics. Today is February 4th, 2021, and as some of you may know, today is World Cancer Day. When we think about World Cancer Day, there really are a lot of directions our minds could go. You may reflect on a loved one who struggled with or passed away from cancer. You may think about someone you know who is caring for a relative who has cancer. You may also think about all of the treatments out there and how far we've come in the past couple of decades with cancer survival and remission rates. Keeping all of that in mind, I want to focus today on some of these aspects of this topic that we cover in our EBSCO resources and how they can apply to your life and day-to-day work if you're in healthcare. So first here we have Dynamed. We have a whole specialty area for oncology, so you can see the breadth of our topics here. So if you're interested in the management of breast cancer, take a look at all of these topics we have here. Interestingly, while I'm making this video today, I see all of these updates from the past couple of days on a few different cancer topics. And the update actually tells you what kind of update this is, so let's click into one of these here and see what we have. If we take a look at management of advanced renal cell carcinoma, we see that Cabometyx is FDA approved in combination with Opdivo for the first-line treatment of advanced renal cell carcinoma in adults, and that is from an FDA press release in late January. If we click into it here, we can actually see the update within the topic with a few more details as well, including efficacy evidence and adverse effects. If you click here, go to the top, you can see all updates for this topic, or you can follow it as well if it's something that you want to make sure you stay current on. We also even have a topic on COVID-19 and patients with cancer, and there are some recent updates for that one as well. This is a topic that I'm following, so I'll click on one of my recent updates. You can read some of the updated professional recommendations here. So we have the American Gastroenterological Association recommendations. You see here the exceptions noted to evaluation of cancer patients with COVID-19. You can also click up here and see some initial considerations, including risk factors for severity and mortality of COVID-19 in cancer patients. If you see a link out here, you can click on that and read even more, so keep that in mind as well. There's another aspect to this topic that a lot of people would think about, which is the more personal aspect. What about the people who are caring for their loved ones with cancer? How can they be supported in the healthcare environment? In my experience as a nurse and in life in general, I've seen people who have no healthcare background, no medical experience, and all of a sudden they're having to be full-time caregivers for loved ones with medical conditions. So it's important for healthcare clinicians to recognize these people as needing help too, as an extension of the patient's plan of care. So here in Dynamic Health, which is a great resource for our nurses, you can type cancer caregiver. The first result is a nursing skill which helps guide the nurse through supporting the family member or friend who is going to be the caregiver for the patient who has cancer. You have the purpose of the skill, which is to provide support to the caregiver and making sure that that care is culturally competent, individualized, effective, and decreases caregiver anxiety. If you come down to considerations, it mentions some facts to keep in mind about caregivers of patients with cancer. You want to recognize that there may be significant physical, social, and emotional challenges. Patients who are frequently transitioning from hospitals back to home or vice versa, or facing frequent readmissions, will increase the burden on the caregiver. It even lists some interventions that can help with caregiver stress relief and coping. If you expand this carrot here, you can see some caregiver challenges that they face. Up here under related content, there is also a patient instruction skill about teaching patients with cancer. So if you are a nurse and educating a patient and their family, Dynamic Health can be a really good resource for guidance on educating both patients and caregivers. Well, that's all I have time for today. I hope you found this useful. Please stay tuned for future videos and be sure to click on the links below in the description to give us your feedback. If you are a subscriber of Dynamed or any other EBSCO resource and have a question about implementing your resource, learning more about it, or promoting it more to your staff, there is a link for that as well. Be sure to click on it and ask your question. If you are watching this and thinking, how can I get all these great resources? Use the same link and let us know that you're interested. Remember, if you don't have access to Dynamed, you can experience the content in our app using a limited guest access subscription. Okay, thank you again and see you next time.